The COVID-19 pandemic, also known as the coronavirus pandemic, is a global pandemic of coronavirus disease 2019, COVID-19, caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. The novel virus was first identified in an outbreak in the Chinese city of Wuhan in December 2019. Attempts to contain it there failed, allowing the virus to spread to other areas of Asia and then worldwide in early 2020. The World Health Organization declared the outbreak a public health emergency of international concern on January 30, 2020. As of November 24, 2023, the pandemic had caused 772,165,753 cases and 6,981,250 confirmed deaths, ranking it fifth in the list of the deadliest epidemics and pandemics in history. COVID-19 symptoms range from asymptomatic to deadly, but most commonly include fever, sore throat, nocturnal cough, and fatigue. Transmission of the virus is often through airborne particles. Mutations have produced many strains, variants, with varying degrees of infectivity and virulence. COVID-19 vaccines were widely deployed in various countries beginning in December 2020. Treatments include novel antiviral drugs and symptom control. Common mitigation measures during the public health emergency included travel restrictions, lockdowns, business restrictions and closures, workplace hazard controls, mask mandates, quarantines, testing systems, and contact tracing of the infected. The pandemic caused severe social and economic disruption around the world, including the largest global recession since the Great Depression. Widespread supply shortages, including food shortages, were caused by supply chain disruptions and panic buying. Reduced human activity led to an unprecedented decrease in pollution. Educational institutions and public areas were partially or fully closed in many jurisdictions, and events were cancelled or postponed during 2020 and 2021. Many white-collar workers began working from home. Misinformation circulated through social media and mass media, and political tensions intensified. The pandemic raised issues of racial and geographic discrimination, health equity, and the balance between public health imperatives and individual rights. In epidemiology, a pandemic is defined as an epidemic occurring over a very wide area, crossing international boundaries, and usually affecting a large number of people. During the COVID-19 pandemic, as with other pandemics, the meaning of this term has been challenged. During the initial outbreak in Wuhan, the virus and disease were commonly referred to as coronavirus, Wuhan coronavirus, the coronavirus outbreak and the Wuhan coronavirus outbreak, with the disease sometimes called Wuhan pneumonia. In January 2020, the WHO recommended 2019 nCoV and 2019 nCoV acute respiratory disease as interim names for the virus and disease per 2015 international guidelines against using geographical locations, e.g. Wuhan, China, animal species, or groups of people in disease and virus names in part to prevent social stigma. WHO finalized the official names COVID-19 and SARS-CoV-2 on February 11, 2020. WHO additionally uses the COVID-19 virus and the virus responsible for COVID-19 in public communications. As of March 10, 2023, more than 6.88 million deaths had been attributed to COVID-19. The first confirmed death was in Wuhan on January 9, 2020. These numbers vary by region and over time, influenced by testing volume, healthcare system quality, treatment options, government response, time since the initial outbreak, and population characteristics such as age, sex, and overall health. Symptoms of COVID-19 are variable, ranging from mild symptoms to severe illness. Common symptoms include headache, loss of smell and taste, nasal congestion and runny nose, cough, muscle pain, sore throat, fever, diarrhea, and breathing difficulties. People with the same infection may have different symptoms, and their symptoms may change over time. 3 common clusters of symptoms have been identified: 1 respiratory symptom cluster with cough, sputum, shortness of breath, and fever. A musculoskeletal symptom cluster with muscle and joint pain, headache, and fatigue, a cluster of digestive symptoms with abdominal pain, vomiting, and diarrhea. In people without prior ear, nose, and throat disorders, loss of taste combined with loss of smell is associated with COVID-19 and is reported in as many as 88% of cases. The standard method of testing for presence of SARS-CoV-2 is a nucleic acid test, which detects the presence of viral RNA fragments. As these tests detect RNA but not infectious virus, its ability to determine duration of infectivity of patients is limited. The test is typically done on respiratory samples obtained by a nasopharyngeal swab. However, a nasal swab or sputum sample may also be used. The WHO has published several testing protocols for the disease. Preventive measures to reduce the chances of infection include getting vaccinated, staying at home or spending more time outdoors, avoiding crowded places, keeping distance from others, wearing a mask in public, ventilating indoor spaces, managing potential exposure durations, washing hands with soap and water often and for at least 20 seconds, practicing good respiratory hygiene, and avoiding touching the eyes, nose, or mouth with unwashed hands. Those diagnosed with COVID-19 or who believe they may be infected are advised by healthcare authorities to stay home except to get medical care. Call ahead before visiting a healthcare provider. Wear a face mask before entering the healthcare provider's office and when in any room or vehicle with another person. Cover coughs and sneezes with a tissue. Regularly wash hands with soap and water and avoid sharing personal household items.